Hello everyone. I would like to welcome Dr. Ankita or Vaidya Ankita on this series of podcasts for Project Prakriti. I would like to thank you, Ankita, for joining us on this podcast. I've been really interested in learning about Ayurveda, and I'm really excited to know more and learn more from your experiences and your education. So I just would like to introduce you to our viewers. So, Dr. Ankita, she got her MD degree from National Institute of Ayurveda from Jaipur, Rajasthan, in India. She got the Science Awardee for exemplary academic performance. She was a senior research fellow and a resident doctor. And after her career in India, she moved to the US to pursue her master's in public health nutrition from the School of Medicine at Case Western Reserve University. So again, I would like to thank you for joining us. Um, yes, really excited. I just starting off to ask you, why did you choose Ayurveda as your career? What pushed you towards it, and what pushed you towards continuing your studies with Ayurveda?
To be honest, Anirudh, I didn't choose Ayurveda. Ayurveda chose me, I think. So, um, actually, I was more inclined towards bio, and I was preparing both for RPMT and RPAT. So, RPAT is an exam conducted by government to get admission in Ayurveda, Unani, and homeopathy. And eventually, I got selected in RPAT, and I got admission in BMS. So BMS stands for Bachelor of Ayurveda Medicine and Surgery, and it's a 5.5 years of program. So when I got my selection in BMS, that time I was in my 20, and at that time Ayurveda was not that much famous like it is today. So people were trying to revive this medical field by promoting yoga and meditation. So I also was in my 20s, and my perception for Ayurveda was not that good. I used to think it's kind of a traditional medical science where we use spices from our kitchen to treat people. That was my perception in the beginning. But as I started reading about Ayurveda, when I got to know what it is, then it was like it amazed me, because you can actually think like it is said, like still we don't know the timeline of Ayurveda text, but it is somewhere it is said like 5,000 year ago, whatever the acharya or Ayurveda physician, they wrote some textbooks of Ayurveda, and in that they mentioned all about the causes of diseases, classification of diseases, pathogenesis, complication, treatment of diseases, without having any diagnostic equipment at that time 5,000 years ago. So that was so shocking for me. Obviously they didn't use the medical terminology what we use nowadays. They didn't use, they had their own terminology, but we should respect them because they tried to write all these causes and everything. So they should have that kind of intellectual that they wrote about these things. So that's amazed me, and that's how I got interested in Ayurveda. But it was not like my faith still was there. It took like so many years to establish my faith in Ayurveda. When I got my admission in MD, that time I had like lot of hands-on encounter with patients, and I saw the results of these Ayurveda therapies in patients where they were really getting benefited from these treatment principles, from this treatment, and we can see the result from our eyes. So that means it was not all of a sudden I got interested. It took years, it took experience, it took a lot of reading, and that's how I came here.
Yeah,
I'm still a learner. I'm still a learner. I'm still learning about Ayurveda. Yeah.
yes. That's really fascinating. It's very fascinating. It's just the reason why I got in, like, was so into Ayurveda. What really pushed me towards was I was into a lot of yoga, and mainly my grandmother. She knew a lot of traditional medicine, and they were so effective all the time. And so I was like, all this knowledge that has been compiled by these ancient people, the knowledge, the simple, connection with the nature or Prakriti that they had, it's fascinating.
Fascinating, because I also was not introduced as a child with all these kind of things we have in our tradition. We have, like, we have all this treasure. This is our treasure, but I didn't get a chance in my childhood to get to know about these things, and I think you are fortunate enough that you got to learn from your grandma. So yeah, it's quite interesting.
Right, right.
So, uh, the other question that I would like to ask you is, what is the origin of Ayurveda? What does Ayurveda mean to you?
What is really a difficult question for me, Anirudh. I'm still trying to understand because it means a lot to me in so many ways. So I'm still trying to compile all my things that what it means to me. But as a first point, I will say is a set of guiding principles uh, or set of guidelines that directs a person to lead their life in a healthy way. So here I would like to stress this healthy way or healthy life, because when you say healthy and long life, actually, because when you say long life, nowadays people have this long life, but they also have diseases. So it's long with diseases. So it doesn't matter. Like it means that they are trying to live a life with complication, with having disease.
Yes, it means that the quality of life has reduced, but the time of living has increased.
What Ayurveda was trying to focus on is we should live a longer life, but it should be a healthy life. So that I think Ayurveda can really contribute. And if I talk about what it really means to me, so it's still an evolving science with a lot of scope of research. um, because we still need to establish clinical guidelines for against specific diseases that are prevalent in these eras. In this era, like we have diabetes, we have hypertension, we have so many diseases. So for this we still need to gather the data, we still need more clinical research, we still need to elaborate more. We need to dig deeper into this science. We need support from other scientists from other fields, so we can really help this beautiful science. And on top of this, I think this is the science that can help to address preventive health, public health, diseases where we have limited scope. We in modern aspect also, like there are some diseases where we don't have any scope. We have surgeries, we have like cancer, so many diseases where we don't have any scope for patients. In those fields, still if we can try to take help from this science, that would be better. um, what more I can say? Yeah, the most important thing, we really need to educate people to tell them the truth about Ayurveda. So there are so many myths about Ayurveda that is currently going on in society. So Ayurveda is not about, like I said in the beginning, it's not about treating with spices that are available in kitchen. It's a science. So everything depends upon the body, the stage of the disease, what kind of patient it is. Everything means there are so many factors that play a part. So there are different aspects that Ayurveda covers, like public health, preventive health. So if we talk about Ayurveda principle, for example, and in preventive health, it is said like we should consume tripla with honey with ghee at bedtime every day. But this principle is written for healthy people and people who are in healthy status, not for people who have any kind of diseases. So this principle won't apply in people who have elevated excessive vata in their body, and they are trying to consume this tripla. Then they can have severe, they can have like more vata in their body. So it's really, we should not just follow others direction. We should seek treatment from an Ayurveda physician instead of like just listening from someone that, oh, tripla is really good for my body, I should take it. It doesn't work like that.
That's what happened to me when I was young. What used to happen was I just used to be like, oh, tripla is good for your digestion, and I used to take every night, and I kept taking it, and I ended up facing a lot of vata related issues like joint pains, chondromalacia patella was one of the things that I had. So there's a lot of things that happens when not knowing it properly and you just apply the general principle, it never works. So there's a lot of culture where people send a lot of WhatsApp forwards on different types of medicine. People don't understand the concept of the body type. Can you talk a little bit more about it, why that body types are important and why the particular treatment doesn't apply for everyone?
Yeah, so in Ayurveda we have Vat, Pitta, Kapha, Dosh, Dhatu, Mala. So our principles are based on this Dosha Dhatu Mala, the status of the body, where you are living, what kind of situation you are living, what kind of weight you have. So there are different factors that play a part in this. Like if I talk about a Vata person, so Vata person, if we are giving medicine that can increase the Vata in his body, then it won't be a good treatment. So like you said, you were taking tripla for so long and you ended up having some joint pain or things. So that kind of thing, you superficially, like I can't cover all these things in like today's video, but we have like Vata, Pitta, Kapha, 3 dosha, and then 7 dhatus, Ras, Rakt, Mas, etc. And then we have Mala, like we have Sved, Mutra, and Chakra. So we have 3 Mala.
The waste of the body.
Yeah. So in Ayurveda, it depends upon the dosha dhatu mala, and that's how we diagnose a disease. That's how we treat a person. So it depends upon a lot of factors. And yeah, the one thing I just wanted to say in this video, and I think I forgot to say, is about today what is happening. I really respect how this we are trying to follow Ayurveda principles nowadays. We are hearing a lot from other people that, oh, we should follow Ayurveda and all, but still we heard a lot about the spiritual well-being related to Ayurveda, like yoga and meditation. But at the same time, I'm not denying the benefits of yoga and meditation because I love that, but at the same times we could not overlook the clinical significance of Ayurveda. At the same time, parallelly, we need to work for its clinical significance, and for that we need to actually come up, especially the physicians and the scientists. We need to come up and talk about it. So yeah.
Wonderful. When we grew up, the most common text of Ayurveda that we always hear is the Charak and the Shushvat. But when I initially interacted with you, you mentioned the book called as Ashtang Hriday, which is what you said was one of the books that you really like. Could you elaborate a little bit more on what that book is and what did you learn from it?
So I think everyone who is listening, at some point of your time you heard about this Charak and Sushruta. You are well aware about Charak and Sushruta. So like that, in Ayurveda we have so many written texts. So we have Ashtang Hriday, Ashtang Sangrah also. So Ashtang means 8 and Hriday means heart. So the book that has 8 branches, and the heart, why it is given the name of heart? Because heart is the main organ of our body. So like that, in this book, in Ashtang Hriday, they try to compile the essence of all the text that were scattered, and they try to compile the essence and compile in this book for these 8 branches. So That's why we call it Ashtang Hriday. So what was happening at that time in the we had like lot of Ayurveda scholars. Like that time Ayurveda was main clinical science 5,000 years ago somewhere. So there were a lot of scholars like we are now students. So there were a lot of scholars and they were writing different texts on different branches. So like someone is on writing on the upper part of body's diseases, someone is writing about the lower part of the body diseases. So there were many texts, and it was really, it was getting difficult for them to, for us nowadays, it was difficult for them to get all the knowledge from one text. So that's why the writer of this book, Vagbhata, he tried to compile all those essence and compile in this book, so we can get the knowledge together. So it's easier to grasp. It's not too short, not too elaborative, not in too detail. So it's like if you want to get the whole essence, just so you can read this book. So in this book we have 8 branches, like I said: Kai, Bal, Graha, Urdhvang, Shalya, Drashta, Zara, Vrashan. So Kai means general medicine, Bal means pediatrics, Graha means now we can say psychiatry, Urdhvam is diseases related to the upper part of the body, Shalya means surgery, Agad means toxicology, and Jara geriatrics, and Vrashan aphrodisiac. So that time, now you can imagine, at that time they wrote in detail about these branches. Think about that. Like in this era we have everything. That's why we can do the research, we can do these things, that things. But that what is surprising for me, they wrote about all these branches. So yeah, so this Ashtang is about um, about principles, Ayurveda principles that we should follow or we should use if someone is affected with any diseases.
So that research mentality, even though we didn't have this modern tools back then, people were still into that scientific thinking to research and to get this knowledge and to apply it and experiment. So that kind of a mindset was there throughout in the past, is what I'm sensing.
It's like we should follow these principles blindly. They also say that we also saw this in their generation, they also saw in their generation, they also applied it, then they saw the results. That's why they have written in this book. So it's like it was not like a thing that, oh, they got to know from somewhere and then just wrote. They also applied it, they also saw the results. That's why they wrote. So now so many parts like we have forgotten and we are lacking in research. That's why so many parts we don't know about nowadays. Like in toxicology, if I say toxicology means there is a big part toxicology in Ayurveda, but nowadays because we don't use it, we don't know about it. If you want to revive, then we have to do a lot of effort, because they wrote so many principles in toxicology. Now we don't have any idea how to do it. We can't implement it because they wrote it. Now is we lost it because it's there in theory, but we don't know how to do practically. So there are so many these kind of principles in so many branches. If you want to revive again, then we need to do a lot of work.
Yeah. I mean, that's what has been very interesting. I mean, that's the main goal of why we started this podcast, was to try and combine the modern scientific outlook with the traditional medicine so that we can make more sense of what it really is. And with the, today's generation, with so much of access to information, a better understanding that will help people for sure. Dr. Ankita,
much
Thank
for
you, Anirudh.
joining us.
Thank you, Anirudh, for having me. I always love talking to you, actually.
It's wonderful to have you, and I really look forward to do the next podcast we'll definitely get back to our viewers with what that next topic is going to be. If you would like us to cover any particular topic, please leave a comment. We'll try to cover that through the series of this podcast. With Dr. Ankita, thank you so much. You have a wonderful day. Thank you.